Artificial intelligence doesn't know medical facts. It analyzes patterns across enormous amounts of written information and predicts the most likely answer. And that often makes AI clear, organized, confident, but not always complete. And that's the lens we're going to be using today. All right, so lately there's been something really hard to ignore in the comments section of my neuropathy videos, most of them. More and more people are bringing in answers that they got from AI and asking me to weigh in. Sometimes they'll quote it directly, sometimes they'll ask me if AI is right, and sometimes they assume that I'm using AI to write my responses. So I opened up ChatGPT and started asking it the same questions, and then realized I had never actually sat down and explored the quality of info that AI spits out about neuropathy when I ask it the same questions that you guys ask me every day as patients. Most people think AI is one of two things, either incredibly smart or incredibly unreliable. And the truth is probably somewhere in between, so I decided to find out. Some of the answers were actually very good, and a few gave me pause. And I started with the question most people will eventually ask. Once it starts, can neuropathy ever be fully reversed? Now, at first glance, that's a pretty reasonable answer. It's balanced, it's cautious, it acknowledges different causes. But here's where it gets kind of interesting. AI defines reversed clinically. Right? Right. So right here, you see this is how it sees reversed, but patients define reversed personally. It's going to be different for everyone, right? There's also another layer here that I think is really important for those that might not understand AI and how it works. The more you interact with AI platforms, whether it's ChatGPT, Claude AI, or something else, the more it adapts to how you communicate. It mirrors your language, it anticipates follow-up questions, and it refines its responses based on what you emphasize. And over time, that can start to feel a little like emotional intelligence. It can feel like you're being understood. And when it feels like something understands you, it's very easy to trust it. But feeling understood and being medically evaluated are not the same thing. There's also a bigger reason I think that this matters. AI isn't just something people experiment at home with anymore. It's being integrated into healthcare systems more and more. Triage, documentation, and symptom screening. So anybody watching the latest season of the PITT, they are actually exploring this very topic with Santos's character and the introduction of AI charting in the emergency room. And I get the sense that it is not going to go well for her. Yeah. So understanding what AI actually does well and where it has limits isn't just interesting, it's relevant, especially in conditions like neuropathy where nuance really matters. For instance, the difference between metabolic neuropathy, autoimmune overlapping, medication-induced damage, or multiple causes happening all at the same time show up not so cleanly in a checklist, right? That's where clinical judgment still plays a role. And sometimes that tension between probability and possibility works the other way too. So to give you an example of this, I have a friend who found a lump in his testicle in his early 20s. Statistically, the odds were in his favor. Most lumps at that age group, benign. And his doctor even told him it's probably nothing, but sent him for testing anyway. And it turned out to be cancer. He had surgery, he went through chemotherapy, all is well today. But the point of this isn't that statistics are useless. It's that probability isn't the whole story. Good medicine lives in that space between what's likely and what's possible. So AI give you what's statistically typical. Clinical judgment asks, but what if this is the exception? So after that, I wanted to see what would happen when I shifted from possibility to more of a sense of urgency. Because once people accept that neuropathy might not be fully reversible, the next question is usually, what is the fastest way to make this better? And then that very quickly morphs into what supplements actually work. Now, again, at first glance, this is a really reasonable answer. It's balanced, it avoids promising a quick fix, it lists commonly discussed supplements, but it gives you a list. It doesn't automatically go deeper, and that is another thing that made me really curious. So instead of switching platforms, I kept everything the same and just changed the question. Watch what happens when it becomes more specific. What supplements have the strongest evidence for diabetic neuropathy improvement? What form of thiamine, or B1, has the strongest evidence for neuropathy improvement, and at what dose? Now, we're suddenly in a completely different level of detail. The more specific the question became, the more specific the answer we got. And that's a really important detail because most people don't know what to emphasize or ask, right? You just want to feel better and you don't know where to start. You just want relief. So you ask the broad question, believing that it'll give you a broad answer and then maybe you can start there, but this is a very slippery slope. And then once you do get this broad answer and it can feel complete, that answer can feel like, oh, well, there's everything I need to know, but it typically is not. Now, to be clear, supplements do absolutely play a role in neuropathy relief. There's a lot of great research behind things like R-alpha lipoic acid and certain B vitamins and other metabolic supports, but they rarely work in isolation. And I recently did a 2026 update on what remedies I still use to treat my own neuropathy. And improvement usually depends on the bigger picture, like the underlying cause, the metabolic health, inflammatory levels, meds, duration of nerve damage. So a supplement list can be helpful, but it's definitely not the whole story. So I kept pushing the questions a little further down the road each time. And that brings up another question that patients ask all the time. Do I actually need to be formally diagnosed with neuropathy? And if so, why? I mean, is it really going to change the treatment that drastically?
Yep, it is.
And now I already have my answer as to whether there's a benefit to pursuing a diagnosis and going through all of that trouble and testing, and why I arrived at that decision. But let's see what ChatGPT says. All right, so this is a really solid answer too. It talks about nerve conduction studies, EMGs, blood work. But what this answer does not capture is there's absolutely a need for formal diagnosis because it identifies the underlying cause, and this in turn will inform what treatments are aligned. So think about it this way. Mild neuropathy, you can treat with over-the-counter treatments. It's perfectly reasonable. But neuropathy in general is a progressive condition, and it will eventually advance. And then more targeted therapies might get delayed because you're now further along in the disease process, but you still need to do all the testing and the footwork before insurance will pay for the treatment, like IVIG. It also doesn't touch on how confusing this process can be for people, or that many will develop symptoms long before testing becomes abnormal, especially in small fiber neuropathy. Large fiber nerve damage tends to show up on nerve conduction studies fairly quickly, but small fiber damage often doesn't. So someone can have severe burning, tingling, numbness, autonomic symptoms, and still have a completely normal EMG. That doesn't mean that nothing is happening. It just means that we're looking at a different part of the nervous system. And the other thing I want to touch on here, if somebody has strictly small fiber, we fully expect that their EMG is going to be completely normal. That is usually the first step. Usually an EMG is done first, and if that comes back normal, but patient is still very symptomatic, then we kind of springboard over into the skin biopsy, which is specific. It's the gold standard for diagnosing small fiber. So yeah, I mean, it might have been a little misleading when I said, your EMG can look normal. If it's a small fiber, it absolutely will every time. And this is where diagnosis can still matter, because identifying an underlying cause is what helps guide treatment. And this is where things can become really frustrating for patients, because the symptoms are real, but the tests don't always reflect what someone is feeling yet. And in some cases, additional testing like skin biopsies, like I just mentioned, or autonomic studies can help identify things like small fiber. But even then, medicine just doesn't have a way of fitting all of this into a tidy little box. And then this is the other place where AI answers can sound great, but there's still missing part of the picture. It can explain the tests and it can list the possibilities, but along with this, we need some pattern recognition. Patterns in symptoms, patterns in history, patterns in how someone's body is changing over time. And that kind of interpretation still requires clinical judgment, which led me to another question I hear all the time. Why do some people improve from neuropathy and others don't? Now, this answer will usually mention things like the underlying cause, how long the nerves have been damaged, age, metabolic health, and other medical conditions. And those things are all true, but there's another piece of the picture that's easy to underestimate. Nerves heal slowly, very slowly, like almost backwards. They crawl along. Peripheral nerves, to give you some context, peripheral nerves regenerate at roughly 1 millimeter a day under ideal conditions, meaning there is no autoimmune issue, there is no neuropathy, there's nothing. That's how quickly the peripheral nerves normally grow. 1 millimeter a day. 1 millimeter a day is it. And this means that improvement often takes months, sometimes even years. And even then, recovery isn't always complete. And small fiber nerves can regenerate as well, but their healing is actually really difficult to measure. They are microscopic nerve endings that branch off through the skin. So instead of regrowing in one long strand like a cable, like normal nerves do, they regenerate in more complex patterns. And that means recovery can happen, but it's often gradual and very uneven and unpredictable. Some people will notice improvements in burning or temperature or sensitivity over time, while others experience periods where symptoms may improve and then plateau and then improve again. And again, that unpredictability is another reason that neuropathy recovery can just be so frustrating and confusing. Not because nothing is happening, but because nerve healing just doesn't always move in a straight line. And then some people often dramatically improve once the underlying cause is addressed. Others improve partially, and then some plateau, not because they did something wrong, but because the biology of nerve repair is slow and unpredictable. Neuropathy isn't always caused by just one thing. Sometimes there are multiple factors affecting the nerves at the same time. Metabolic stress, inflammation, medication side effects, autoimmune activity. And when things interact at once, recovery becomes much more complicated. And that's another place where simple answers can really fall short with AI. It doesn't know the person and its medical history that's sitting in front of it. It just knows the information that's being input. And maybe if you take the time to fill out the questions that it initially asks you when you're starting to work with AI, it can get to know you in that respect and give you the answers in maybe the tone that you want, maybe challenge you a little bit if you say, don't just constantly agree with me. if I'm wrong, present me with a rebuttal or alternate information. Some people have gotten very good at drafting very specific and targeted prompts for AI that really understands how to pull out information to the maximum capacity. I don't know about the maximum capacity, but a very good prompt can really elicit great information from ChatGPT. But I'm wondering how many people actually know to do that. I don't. I mean, there's whole businesses that popped up just giving you access to prompts for very specific things. I think you can even hire like a prompt consultant or something like. I don't know. Maybe I don't know. It seems like I get bombarded with stuff like about AI consulting all the time, because listing possible causes doesn't always capture how those factors interact inside one person's nervous system. And then that brought me to one final question. Something AI can describe but can't truly experience. What is the emotional impact of living with neuropathy? Now, AI has no problem listing symptoms, and it likely will, but anyone living with neuropathy knows that it's much more than that. It affects sleep, energy, mood, sometimes even your sense of independence. And it can tell you what's typical, but medicine is about recognizing when something isn't typical. And if you want to hear about my experience with that side of neuropathy, I talk about it in this video, which I'll link at the end in the description. And speaking of, if you wait for YouTube to randomly put one of my videos in your feed, you're likely missing out on a bunch of other topics that you might find helpful. Right now, there are over 350 videos on Lucid Med covering neuropathy, autoimmune disease, medication reviews, supplements, and other health topics. So if you're dealing with a health issue, maybe take a few minutes and scroll through the rest of the channel, because there's a really good chance that I've already covered something that could benefit you. And then, as always, thanks for being here, and stay healthy and lucid. Okay. I want to mess with this bob so much. I'm missing 12 inches of hair, in case you haven't noticed. And I'm hoping I don't look like PTA Karen. Yeah, this is foreign territory to me. Okay. Still sticking my lip gloss too. Anyway. Oh God, I'm still short of breath too. Short of breath. Still recovering from my heart attack. Just decided I need to chop my hair off though. I kind of love it. It's much easier to take care of. Yeah. Let's see how many people notice and comment. And then I need to come up with something that we can do. Maybe give me suggestions on that too. All right, I'm gonna shut up now.